Welcome to another edition of I Am AAPC. Today we have Kelsey Seltzer with us. Kelsey, how are you?
I am good. Thanks for having me.
I'm so grateful that you spend a few minutes with me to talk about your career. You have a fascinating career, and as you know, I'm kind of on the hunt to find these nurses and clinicians who've made this transition into coding in the revenue cycle. You are one. You responded to the call.
Yeah, yes, yeah. I sort of got into it from the clinical side. I started as a nurse. I became an LPN in 2012, started working right away at a large family practice in the area. And it was about probably 2016. We were having a big company meeting and they were throwing out all of these HEDIS verbiage, and nobody could really tell me what it was. And I said, I got to know what that is. So that's how I ended up in this world. I went back to school and here I am.
Okay. Was your LPN, working as an LPN, was that your first career then, would you say?
Yeah. Yep.
Okay. All right. Why did you want to be a clinician? What drew you to nursing?
I'm a people person. I love to talk to people, get to know people. I like to help people. I'm a caregiver, a helper by nature. So that definitely, I knew that that's where my career was going to go.
This company meeting you spoke about, you're
Mhm.
hearing all of this new terminology and language. What drew you into that? Just curiosity?
Yeah, curiosity. They were throwing out all this lingo about these new programs that we were going to be starting as we dug into the world of quality value-based care and HEDIS. And I am naturally inquisitive about a lot of things, so I wanted to know all about it. And I did a little research and knew that this is where I wanted to go.
Okay. So you tell me about that research. Like what kind of things were you looking up?
Yeah, so I had wanted to go back to school. The LPN program where I am is a vocational degree, so I really didn't have a college degree of any sort. And I was still young and I knew that I wanted to get a college degree of some sort. So that's where I started researching HEDIS and population health and health information
Oh,
management.
yes.
And so that's how I ended up getting it back into school.
Okay. Tell me about that path then. And I would imagine that your LPN, that's a way to fund this new career path.
Yes, yeah, I worked full time while I went to school. I ended up going back to our local community college for the health information program. I have an associate's degree, and then I took the RHAT certification. And then I started working I got a job at our local hospital, and I was doing inpatient coding. Didn't love inpatient coding, having been outpatient for so long. And then my position opened up at the family practice I'd been at. And then I started doing quality stuff with them. And I was the only one in our department that had a coding background of some sort. So between my clinical background and my coding knowledge that I learned through school, that's how I started really focusing on the risk adjustment coding.
Okay. It sounds like doors may have opened up because you had both the clinical and this new revenue cycle expertise.
Definitely. I would say that having both was really helpful. It's really allowed me to understand, from the clinician side, what they're looking for, what they need presented to them to help them, because their clinicians aren't coders for the most part. They don't love it like we do. So I really know what they're looking for from the clinical aspect when we present to them some of these HCC conditions.
Okay. Do you remember the first time you saw the code books, your CPT and ICD-10? Was that in while you were nursing or when you first stepped into your revenue cycle education?
That was when I was in revenue cycle education, and it was shocking. Nursing textbooks are pretty intense, but that nothing like that code book.
All along the way, you knew that this was it. This was the right path.
Yeah, once I really started digging in after that employee meeting that we had, once I started digging in, I knew that this is how where I wanted to be. This is the road I wanted to go down.
What kind of things appealed to you about it, Kelsey?
Um, I I like data. I'm a bit of a nerd when it comes to data and spreadsheets and stuff. I like that stuff. I like figuring things out like that. So definitely the performance. I like to be the best at everything. So if this was going to help my practice that I worked at be the best in something, then I was going to give it my all and do it.
Okay, all right. And what were there certain topics through your education that just really resonated with you that you love more than maybe other topics?
I did like coding when we were doing the coding. I did really enjoy that. And then I took a reimbursement related class in college. And that's really when I dug into the value-based care reimbursement side of things. And it was a shoo-in from there. I knew that that was where I was going to be.
Okay. And you brought up your RHIT
Mhm.
credential with AHIMA, and they focus on inpatient. And you mentioned that inpatient didn't really do it for you. Why?
Yeah.
Why is that?
My background is all outpatient. It's all in family practice. So the coding guidelines and the coding rules with inpatient are a little bit different than outpatient. Some of the procedures were way more intense than anything that I was familiar with. So understanding some of that stuff was more in depth than I remembered from when I was in nursing school.
That's interesting because your background where you'd worked as a clinician, that kind of helped dictate the path that you would take with coding.
Oh, 100%. Yeah, I'm still work right now doing coding at the family practice that I started at in 2012.
Okay, all right.
Yeah.
And uh, at what point does AAPC and the CPC credential come into play in this story?
Yeah, so I started in my current role doing population health with value-based care in the fall of 2020. And I was in for a couple of months doing this stuff, and then we really started to look more at the HCC coding, and that naturally came to me having the RHIT and the clinical background. And I knew that I wanted to be a little more specific. I wanted to be the best, know all the things for when it came to HCC coding. So I did a little research, found AAPC, and took the CRC exam.
Okay. Oh, so the CRC, you have the CRC and the CPC, or tell me about the AAPC credentials you have.
I have a CRC through AAPC.
Okay, the CRC
Yep.
exclusively, and that's the
Yep.
risk adjustment.
Yes.
Okay, all right. And what was that like? Because AAPC exams are notoriously difficult. They need to be to show that our students are ready to be in the workplace and have an understanding of things. What was that experience like?
It was intense. It's just a lot of knowledge, and I'm very fortunate that I was able to work in risk adjustment coding prior to taking the test, so I did have that base knowledge of it, which was helpful. But it was still intense. But I felt well prepared with the study guides that AAPC provides, so I did feel pretty good going into the test that I was
Okay.
prepared.
Yeah, you seem like you're someone who's precise and is going to cover all your bases to make sure you're heading in the right direction.
Yeah. Yep.
Do you
Yeah.
have
That's
any tips for someone who is considering taking an AAPC exam?
do it.
Just do it.
Do it. It's a lot. It's intense. You're going to probably think, what am I doing at some point when you're studying, but it is so worth it. Coding is a great career opportunity. It's really great.
And going back to your AHIMA credential and your
Mhm.
AAPC credential together, and we spoke about how AHIMA has a presence as inpatient and AAPC is pro fee or outpatient. If you could go back knowing where you'd be now, would you do anything differently?
I probably would. I would probably, if I had more knowledge about AAPC before I went back to school, I probably would have gone and done more AAPC based credentialing versus the AHIMA credentialing. It's just what I use more in
Yeah.
my career. I use more
Yes.
of my AAPC skills.
Okay. All right. Tell us a little bit about your current role, Kelsey. What do you
Yeah.
do?
So I work in family practice. I work with the insurance companies. They have in their quality program, they have their people that reach out to us and say, these are the suspected HCC conditions that we need addressed this year for the RAF score. So I take that information, digest it, and put it out to present it to my physicians in the best way that they can understand it. So I basically just get the codes from the insurance companies, and then I do some chart research and try to find the supporting documentation to present that to my providers the best way that I can for them to support those that are appropriate conditions to be coded.
You know more than I do about how the revenue cycle is constantly evolving, changing year after year, quarter after quarter, new codes and regulations. How does that affect what you do?
It definitely makes it a little bit tricky, it seems like, especially this year with the V28 changes with HCC coding. There were some codes that I had really gotten my providers down pat and they knew what they were doing and they were confident. And then those codes now don't risk adjust. So now we've got these other codes to focus on. So that did throw a little wrench in things, but we're figuring it out.
But that's just the natural the natural flow of the revenue cycle and medical coding is that
Yeah.
evolution. Like so, do you enjoy that constant change and having to constantly learn?
I do. It keeps me on my toes. I like always having new things to learn and figure out and understand, and then basically presenting that and teaching that to my physicians. I like that role.
Okay, all right. Now, thinking about other nurses who may be thinking about taking the similar path, and one thing I'm learning is that every nurse I've spoken to, there is no similar path. Right,
No,
everybody, and here you are with this unique journey yourself. How would a nurse know if this is a good step forward for them?
you have to be at least a little interested in the coding revenue side of things. If you're really more of a clinical minded person, it may not be the best route for you. But if you like to understand and know the data behind things and why we need to use certain codes and the rules and methodology behind that, this is definitely a great option.
You are just soaking up all of this new information all the time, and you obviously love where you are and what you do.
Yes, yeah. I love the practice I've worked at. I've been there for a long time and I love it. It's great.
Well, do you still keep your LPN current?
Yes. Yep. I still work actually per diem because I did miss some of the clinical aspect of things. So I just started working per diem at our local pediatric urgent care once a week just to get a little taste of that clinical side. So
Well, what do you miss most about the clinical care, Kelsey?
the people, I'm home by myself most of the time. We work from home. So I'm here by myself, not talking to anybody but me. And I like to talk. So that's probably the part I miss the most.
Yes, yes, yes.
Yeah.
Well, if you were to, let's just give one final message to nurses who may be watching, thinking about this. What path would you recommend that they take to in exploration? Because you obviously did a lot of exploration. What would you recommend to them?
If they're looking specifically to get into the risk adjustment side of coding, definitely look into taking the CRC exam. A lot of places companies that I've worked with, they have RNs that are also CRCs. So they sort of skipped that CPC step, and between their RN and the CRC, that was a great fit for them. So if that's the route you want to do, if you're not really interested in the risk adjustment coding, definitely look into the CPC because there's a ton of other areas where nurses are needed with coding background.
Yes, and when you get the CPC, that's often the foundation for
Yes.
most of our members. And
Yeah.
you took your own unique route and built your
Yes.
own foundation. But from there, and maybe you can talk to this, Kelsey. It seems like many people do stay in a production type of coder role and they love it, but many others take off in these other directions, like yourself, and you end up in compliance or auditing, their education, things like that. Have you witnessed that yourself?
Yeah, it seems like a lot of people, we all sort of started out in this general coding area somehow. And then the more we get our feet wet with coding, we find the little niche that we like. And we all sort of shoot off into our own path into what we find that we like. My aunt, for example, has been a coder for a long time. She loves inpatient. She loves inpatient, the radiology stuff for me, hard pass. So yeah, you find your little niche once you really dig into coding and go down that path.
Were you a coder before she was?
No, she's been a coder a lot longer. She's been a
Did
coder
you
for
know
longer.
about that?
I did, and when I was in clinical, doing nursing and stuff, I was like, no way, I don't want to do that. I don't think that's something I would like. And then I dug a little deeper and found more about it, and it obviously is something that I love.
All right. Kelsey, I appreciate your time. Thanks for sharing your story with us.
Absolutely, thanks so much for having me.